Well, you may be signing up to get a third dose of a COVID-19 vaccine fairly soon. U.S. health officials are expected to recommend as soon as this week that all Americans get booster shots. Fox 43's Madeline Cudahy here now with the latest on the details and the timing.
Well, Evan, these booster shots could begin for people as early as this fall once the FDA formally approves the vaccines. Now, when I spoke with Dr. John Goldman from UPMC, he wasn't surprised with the new developments, but questions remain, including who will get it first, why do we need a booster this fall, and what, if anything, makes this shot different.
I don't think that this is a surprise. I think most of us thought that it was likely that at some point we would get booster shots.
A third shot coming this fall, as sources say President Biden wants boosters ready to deploy around 8 months after second vaccine doses. Dr. John Goldman with UPMC says health-wise that timing is important as vaccine protection wanes and COVID-19 cases in Pennsylvania rise.
We've seen that there may be some fade out of protection against COVID with the vaccine. So I actually think that the timing of the booster dose will be that it'll be well timed, because for central Pennsylvania, we'll be getting it right about the time we would expect cases to be going up. And we'll probably see an increase in cases in Pennsylvania in the fall as people head back inside as they get closer together.
Experts believe the order of prioritization for boosters will begin with nursing home residents, followed by healthcare and emergency workers, older Americans, and then the general population. Goldman says the third dose, identical to the first two of the Pfizer or Moderna, will help ensure longer protection against the virus.
You get a booster dose with the same vaccine that you got your original vaccine series. So it's the same vaccine, same dose. It's just a third shot, and it's the same shot as you got the first two times.
But while boosters are a good thing, they aren't the most important part.
But almost everyone in our hospitals right now is unvaccinated. So I think the most important thing is not so much if you need a booster, but if you haven't been vaccinated, you should be.
New and drastic public health measures as the Delta variant continues to spread. And Dr. Goldman stressed that the current vaccines are highly protective against the Delta variant, but that as time goes on, there may eventually be a possibility of booster doses tailored specifically to variants of COVID-19 if that becomes necessary. Evan, I'll send it back to you.
All right.